Namo tassa bhagavato arahato samma sambuddhassa. Good morning, everybody. I'm recording this little talk from Chuang Yen Monastery in Carmel, New York, and today is the morning of March 29th. I made a recording of some reflections on the coronavirus about a week ago on March 23rd. And so now 6 more days have gone by. And according to the statistics that I gathered this morning, at present globally, there have been 660,000 cases of reported infections with the virus and 30,000 reported deaths from the virus. And I have to emphasize that these are reported or recorded cases. There can be many more cases of people infected which have not been reported, confirmed, and recorded. Here in the United States, according to the figures I collected, there have been approximately 120,000 infections and 2,000 deaths. The number of deaths has doubled over the past couple of days. In the New York area, actually in New York City, there have been 52,000 cases of infection reported and approximately 800 deaths. The country with the greatest number of deaths so far is Italy, which has recorded 10,000 deaths. And when we look at these figures, and we could see how cases of infection are spreading all around us, even amongst people who are famous, prominent, powerful, eminent, people who never thought they would be infected, then our own minds might be always constantly overcome by fear, by worry, by anxiety. What should happen if I get infected? And this fear is quite justified. It's not an irrational fear, because the virus spreads almost in invisible, imperceptible ways. And though there are measures that we can adopt, measures that are recommended by the various institutes of health, by the medical professionals, methods that we can adopt to protect ourselves from infection by the virus, no method is absolutely foolproof. There's no we can't guarantee that we'll be completely invulnerable to the virus. In fact, one day this past week, while I was taking a walk around the monastery, I saw a parcel that the post had thrown over the gate, and I had picked up that parcel and brought it to the person for whom it was intended. And after I did that, suddenly the fear came over me. I picked up the parcel with my bare hands, that what if that parcel had been infected with the virus? What if it was carrying the virus? And perhaps I too would have been infected without knowing it. And I expected any day I would start to get symptoms from the virus. And so there came over me a fear, even almost some degree of panic, that here I am in relatively secluded conditions. I get infected with the virus. And maybe if the virus, the disease starts to advance very quickly, within a day or two, the obituary for Bhikkhu Bodhi appears on some of the websites, the Buddhist websites. Fortunately, that hasn't happened and I haven't felt any symptoms, but that was a very real possibility. Okay, so I want to give some thoughts, some reflections about how do we deal with fear, the fear and anxiety that can arise over the thought, I might pick up the virus, or maybe I'm feeling a little bit strange today. Maybe I have picked up the virus and maybe it's starting to germinate and to spread within my system. As I said, this can be a very real fear. And though there are some people who say that one shouldn't experience any fear at all, I think it's quite legitimate that one feels an initial wave of fear and worry and concern when, if one starts to feel symptoms or when one considers the possibility that one might pick up the infection. What one has to do is to prevent the fear that arises from overpowering the mind and from incapacitating the mind. And so one of the remedies, the means for dealing with the fear that might arise, is to settle down and not feel immediately compelled to go into action when fear arises. But first, settle down and reflect back upon oneself using that great Buddhist function called mindfulness. So if fear arises, one could go to one's accustomed meditation seat and just sit down, not resolving on a long meditation, but just resolving to sit quietly for 5 minutes, 10 minutes, just to settle the mind and to experience the body more clearly and more intimately. Because it can be that the unusual feelings that one is experiencing in the body, different mood, different sensations in the body, that these are things which are being manufactured by the mind out of that deeply embedded fear and worry about picking up the virus. So settle down and get a sense of the body, what I call a global, a totalistic sense of the body, and then raise the question, am I really experiencing something different? Or is this just something which is being conjured up by my imagination? And then if one can confirm that one is feeling something different in the body, one should check the strange sensations, the unusual sensations one is experiencing, check them against the list of the symptoms of the COVID virus or the coronavirus, of the COVID illness, to see whether they correspond. Because, for example, if you are getting a sore throat and your nose is running and you're blowing into the handkerchief, it's very unlikely that that is the COVID illness. Because the way I've seen it on the websites, the signs, the typical signs of the COVID illness would be a dry cough and tightness or constriction in the lungs. But don't take my word for it, but go to one of the websites. Probably the best source for Americans would be the website of the Center for Disease Control, CDC, or Johns Hopkins University, or any of the other. There are many, many websites which are now listing the symptoms of the COVID-19. And so if your symptoms don't correspond to those on the list, then you can relax. You might have simply a cold or an ordinary case of the flu. And in that case, take the appropriate remedies for a cold or for a flu. If your symptoms correspond to those of the COVID virus, then you should follow the advice given on the websites, the health websites. I'm not a health specialist, so I'm not going to recommend anything. But what I could do as a Buddhist, as a Buddhist monk, is give some advice on how to deal with the fear and worry that arise within the mind. And what one wants to do is keep, I would call this, a healthy dose of fear, taking the sense or turning that fear into concern and the motivation to take the right course of action, but not letting the fear intensify, duplicate, multiply, proliferate, and overwhelm the fear so that one becomes paralyzed with fear, incapacitated, blocked, and impeded from taking effective action. One doesn't want the fear to become something which immobilizes the mind. And so for those who are following the Buddha Dharma, what I would recommend is a method which is suggested in a sutta, a discourse of the Buddha that occurs in the Samyutta Nikaya, the connected discourses. And this occurs in the chapter, it's chapter 11 of the Samyutta Nikaya. It's called the Sakka Samyutta, the connected discourses with Sakka. Sakka was the ruler of the Tavatimsa Devas. And this is sutta number 3, called the Dajaga Sutta, the crest of the standard. It's a crest that is placed on the banner that warring factions of warriors would carry into battle against their opponents. And in the sutta, the Buddha has described a battle that takes place between the devas, the good deities, and the asuras, who are the demons, the anti-gods. And when this battle takes place, Sakka, the king of the gods, tells the devas that when you are engaged in this battle, if fear or anxiety should arise in you, then you should look up at the crest on the top of my banner. And when you look up at that crest, then you'll see that I am present, leading the battle, and then your fear, worry, and anxiety will be abandoned. And then he mentions some other ways that the deities could dispel their fear. Then he applies this to the case of the monks who go into the forest or to a deserted place to practice meditation. And sometimes when they go all alone into these isolated places, a dark forest, fear and anxiety can arise in them with the thought that there might be demons in this forest, or wild animals, or malicious spirits of some sort. And so then the Buddha says, when that happens, then you should call to mind myself, the Buddha himself, calling to mind that I, the Buddha, is one who is perfectly enlightened, the blessed one, the fully enlightened one. And when you think about me, then your fear, terror, and anxiety will be dispelled. If you don't think of me, then you can think of the Dhamma. Call to mind the Dhamma, which is well expounded, directly visible, immediate, something to be personally realized by the wise. And if you don't think of me, you don't think of the Dhamma, think of the Sangha, the community of noble disciples. Think of how the community of disciples is endowed with great virtues of wisdom, compassion, purity, patience, diligence, and so forth. And then with reverence and veneration, bringing to mind the Sangha of noble disciples, the great field of merit for the world, your fear and worry and anxiety will be dispelled. So that is the advice that the Buddha gives to monks who have gone into seclusion to practice meditation. And we ourselves can use these reflections, these contemplations, in order to allay, to dispel our own obsessive fear and anxiety. So you can bring to mind the figure of the Buddha. You can use an image or picture of the Buddha, bring it to mind and think, I have taken refuge in the Buddha, the perfectly enlightened one, the one endowed with boundless wisdom and great compassion. Or you can call to mind the Dhamma, the well-expounded path leading to perfect wisdom and to liberation. Or call to mind the Sangha, the community of great arahats, including such monks as Sariputta, Moggallana, Mahakassapa, Ananda, and so forth, and think of the virtues and the discipline and samadhi and wisdom and liberation of those great monks. And that will help your fear and anxiety to be dispelled. I want to emphasize that doing these reflections, these contemplations, is not a substitute for obtaining proper medical advice. It's not an alternative to consulting with the healthcare professionals, but rather it's a way of temporarily alleviating, relieving the fear and worry that might arise in your mind. And so once you dispel and quiet down this fear, worry, and anxiety, then you should take the action recommended by the health experts. And I will try to attach to this recording some of the websites that you could turn to for professional advice. So I want to end by expressing my wish, my hope, that all of you who are listening will be free from illness, free from affliction, free from the coronavirus and from every other kind of illness. But if you should be infected by the virus, I give my blessings that you will be quickly recover from the illness, regain your strength and your health. And in any case, I hope that all of you will be free from what I call the obsessive and incapacitating type of fear. But you should use that healthy degree of fear to take proper precautions as recommended by the health experts to protect yourself as well as possible from infection by the virus. So let me end with extending the blessings of the three jewels to all of you. Sabityo vivajantu, sabarogo vinasatu, mate bhavatu antarayo, sukhi di gayuko bhava, bhavatu sabamangalang, rakantu sabadevata, sababudhanu bhavena, sadasoti bhavantu te, bhavatu sabamangalang, rakantu sabadevata, sabadhamanu bhavena, sadasoti bhavantu te, bhavatu sabba mangalang, rakantu sabadevata, sabba sanganu bhavena, sadasoti bhavantu te. Sadhu, 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 sadhu.